morning to all. My name is Dr. Renuka Gupta. I am a female cancer surgeon. Today I am discussing about the cervical cancer. Cervical cancer is basically the cancer of uterine mouth. Cervical cancer is caused by human papilloma virus infection. Human papilloma virus infection is a sexually transmitted infection which usually attain after the sexual intercourse. So, the patient who are at high risk of cervical cancers are patient with multiple sexual partners, patient who having a husband who has a multiple sexual partners, patient with early age at first childbirth, patient at early age of first intercourse, and patient who having a sexually transmitted infections. So these patients are usually having a higher risk of cervical cancer. These patients having a high risk of human papilloma virus infection. The young people usually are infected with human papilloma virus. These infections usually cleared by our immunity, but in some patients, as we cannot clear these infections and these infections remain persistent, so persistent human papilloma virus infection in a cervical cells usually predispose a female towards a cervical cancer. So cervical cancer is caused by a persistent human papilloma virus infections. These human papilloma virus, once integrated into the cervical cells, they start transformation of the normal cells into the carcinogenic cells. This process takes time, usually 5 to 10 years, and the precancerous stage having a low grade and high grade lesions in the cervix. Once the high grade lesions is formed, it usually not going reversed and usually progress towards the cervical cancer. The process from the infection to cervical cancer usually takes 5 to 10 years. So it's a very long time in which the infection proceeds to the cervical cancer. So effective cervical screening program can initiated for the cervical cancer to prevent these kind of cancers. Cervical cancer usually present with the symptoms of foul-smelling vaginal discharge, irregular vaginal bleeding that you may bleed in between your periods. You can have a contact vaginal bleeding means or postcoital bleeding means you having a bleeding after intercourse. Cervical cancer usually have two peaks. One peak occurs at 33 to 35 years of age and one peak occurs usually after 60 years of age. Young patients usually between the 30 to 40 years age usually present with a contact bleeding and intermenstrual bleeding. It means you can bleed in between your periods. Old aged women after menopause usually present with foul-smelling vaginal discharge, postmenopausal bleeding. In late stages, patient may present with the urinary complaints and fecal complaints. Sometimes in even stage 4, patient can present with continuous leakage of urine and stool through the vagina. These patients can be diagnosed with the help of perispeculum examination and biopsy. Biopsy is taken with the help of punch biopsy forceps. It can be an OPD procedure or inpatient procedure depending on the stage. Staging is usually done by the clinical examination. If you are in early stage 1, you can be treated with help of only surgery, but in stage 2 onwards, the radiation and chemotherapy will be your treatment of choice. The cervical cancer is a cancer which can be detected early with the help of effective screening programs. Your pap smear and HPV virus testing should be done every 5 yearly to detect the virus infection or any changes which is done by the virus to proceed towards the cancer. If you have any changes, the treatment can be done at the initial stage in which your uterus can be preserved. So, please screen yourself to prevent the cervical cancer. Thank you.